Hello, everybody. I'm Tony Gillespie Weaver Jr., and today we're going to talk about therapeutic interventions using cognitive processing therapy for PTSD or for trauma. Um, I enjoyed this journey of being able to go through and look through understanding cognitive processing therapy, and I hope you all enjoy this presentation as well. All right, so here's the agenda. What we'll talk about today is cognitive processing therapy as an overview. Then we'll look at 5 different articles that I researched when it comes to implementing cognitive processing therapy uh, into um, into various therapies, looking at some empirical articles. The next thing we'll do is we'll take a look at some of the implications of those articles for the counseling field. And what I did is, rather than discussing them along with the research documents, I just provided kind of a one pager that says, hey, here's the takeaway from my research kind of deal. All right. Then we'll look at some social advocacy efforts. And then last, I'll give you some references. All right, so let's go into this overview real quick. Cognitive processing therapy. It is a cognitive behavioral therapy for post-traumatic stress disorder or PTSD and related conditions. And that in its simplest form is what cognitive processing therapy is. It is a type of cognitive behavioral therapy that has a manual that's used so that you can go through the therapeutic process and look at how a person thinks. The main contributors of CPT will be Dr. Risick, Dr. Kathleen Chard, and then Dr. Candace Munson. And so they're actually the authors, and you'll see their names on a lot of the things on cognitive processing therapy. They're the actual authors. This is what I use as a part of the VA. This is the patient CPT handbook that we use, and you can see all 3 of their names are on here as they continue to develop it. All right, so let's look at some goals, and then I'll give just a little bit of history. The thing about this actual presentation is I don't feel like I have enough time. So I'll give just a little bit of history, and then we'll keep it moving once we go over the goals and everything. So anyway, I like the way that the VA, they have a pamphlet, and you can see it. It's kind of, it's on there anyway. There's a pamphlet that they have that shows the goals of cognitive processing therapy. And they broke those goals down into 3 particular areas, which is reflect, redefine, and recover. And so under that are all of the goals of cognitive processing therapy. So under reflect, the goals would be to improve one's understanding about PTSD and to provide kind of an educational academic experience, to examine the impacts of your thoughts and feelings. In other words, to get kind of an understanding of how your thought process impacts how you feel and the things that you do. And then finally, decrease avoidance and emotional numbing. Under the redefine, learning skills to evaluate thinking while also considering alternative viewpoints of trauma of oneself and the world around them and the world around you. So you're learning all of these new skills, and if we're going to do some of this in class, I may bring some of this with me so then you can kind of take a look. But there's worksheets and things to that effect that go into helping to learn new skills and looking at another viewpoint of trauma. There's a specific worksheet in here that I'll try to make sure I bring with me. And then last is going to be recovers to reduce the distress levels related to memories of a traumatic experience, to be able to live with, not necessarily avoiding that particular that experience, but being able to live with it, to be able to talk about it, to process it without it impacting you as much, emotionally and physically and things to that effect. Improve one's day-to-day living, which is very important. Quality of life is always important, and to reduce feelings of anger and anxiety, guilt, and shame. And I think sometimes when we look at trauma, we look at things like anxiety and fear, but as you kind of go through And when you look at some of these worksheets, you'll get a chance to see why there's some anger that can be associated, and guilt and shame as well, especially when dealing with the military population. I'm doing my best to not make this like military heavy, even though I'd like to. Um, but but there's other things that happen with trauma that where anger and guilt can also be issues that can prevent a person from good living. So all right, so the length of sessions, it's a manualized process. I showed you one of the manuals that's used specifically for military personnel. And then it's about 12 to 16 sessions, roughly from 60 to 90 minutes. And then this particular therapy can be used either as a individual therapy or group therapy. And you'll also see where I pulled out an article where it can also be used during intensive outpatient therapy as well. All right, so Dr. Resick started the cognitive processing therapy in about 1988. And then up to that point, up until about 2006, is where there was some continued evolutions and also a need to help veterans who have been dealing with PTSD, dealing with other types of trauma in the military. And so about 2006 is where there was a huge push for dissemination of the CPT manual, as well as certified therapists to help in both group and individual therapy to help military personnel. And the great thing about what Dr. Resick and her team does is that they continue to evolutionize cognitive processing therapy. It's a living, breathing therapeutic approach where and I don't think we're going to have enough time, but there's a presentation that she did back in about 2017 where she talks about how in cognitive processing therapy, one of the things that they do is that they get the information back from both the field as well as from clients who've gone through cognitive processing therapy. Look at the feedback, and then they continue to evolve CPT based on that, and that's one of the things that kind of won me over with CPT. All right, so here's my article overview. I have three slides that talk about these articles, and so of those 3 slides, this is one of 3. All right, so the name of one of the articles was Predictors of Quality of Life Following Cognitive Processing Therapy Among Women and Men in Post-Traumatic Stress Disorder. And then Lisa Glassman was the author of this, and here's the key takeaway that I took from this. Because we just talked about it before about how quality of life is important. One of the key takeaways from this article was that at the end of the research and testing and experimenting, the authors found that CPT, after someone has received CPT treatment, they found that a lot of women found that their quality of life was increased when their depression symptoms had decreased. And then for men, quality of life increased when their anger decreased. In other words, learning those skills to be able to deal with anger issues or issues that would normally cause depression. And so I thought that's a very powerful document. So there's 2 articles on here. The first article is Predictors of Treatment Outcome in Group or Individual Processing Therapy for Post-Traumatic Stress Disorder Among Active Duty Military. And I don't know why, y'all, but all these articles that I found had like extremely long names. But the author was Dr. Resick, who's also, as we just discussed, the doctor who spearheaded cognitive processing therapy. And one of the takeaways from this particular document was that military personnel who were 35 or younger actually benefited more from individual therapy than they did from any other therapies. That the folks that received individual therapy for CPT, and this is just for military folks, this particular article found that folks 35 and younger responded better during treatment, after treatment, follow on. They responded better to the treatment, and it was helpful. So I think that's very important in when talking to and dealing with the military personnel population. All right, so the next one is comparative effectiveness of prolonged exposure and cognitive processing therapy for military service members in an intensive treatment program. And so I actually, as I was reading through this particular article, I started to see some similarities in the treatment that I went through while I was in the military, which was an intensive outpatient program treatment, kind of where it may have started, which may have started with this as being, kind of the pilot of that program. And then I got a chance to see how it evolved, because this particular document talks about how it was only, it's 2 weeks that the cognitive processing therapy was kind of enmeshed with other therapeutic approaches. It was over a 2-week period, and so, cognitive processing therapy, cognitive behavioral therapy, dialectic behavioral therapy, all mindfulness, all those things was kind of enmeshed over a 2-week intensive program. And so when I went through, it was actually roughly 6 to 8 weeks. And so they stretched out the amount of time in this intensive program and made it intense in the sense of the amount of education you're getting versus just intense from a time constrained program of 2 weeks. But anyway, the key takeaway from there is that that CPT is an adaptable approach that can be tailored in intensive treatment, and it also works well or plays well with other therapeutic approaches. All right, and so this was something else that I thought was pretty interesting. It could be a very touchy or taboo subject, but I wanted to bring it up just because it is. And this article was called Hypersexual Behavior as a Symptom of PTSD, and then Using Cognitive Processing Therapy in a Veteran with Military Sexual Related Trauma. And so what this particular document, this was actually a case study that was done versus an empirical document where there was a huge study. But this case study, Dr. Sadie Larson was trying to unpack what was going on with a soldier that had dealt with military sexual trauma, but was also dealing with hypersexual behavior. And so what she wanted to do was first of all specify that there's PTSD, and then specify the comorbidity of hypersexual behavior, and utilize CPT as a means to help the person to kind of work through that. And so I think one of the key takeaways is that cognitive processing therapy, the key takeaway that I took from this is that cognitive processing therapy can help, when there are comorbidities. And sometimes we just got to find out what some of those comorbidities are so that throughout the process of CPT, they can be addressed. All right, so the last one here is going to be cognitive processing therapy, PTS, and university counseling and an outcome study. And so I like to combine this with the other article where it talked about military personnel 35 and under being being impacted by positively impacted by cognitive processing therapy. So key takeaway for this one is that CPT can be used to help college students who have had a traumatic experience. And so while some of the numbers are high, some of the numbers are low, this is still a document that shows that in in university counseling centers, CPT can be used to help, and that it can be impactful for college students. All right, see, I told you I was going to be, running out of time, but so let's go ahead and get through this. So here's the implications of research. If there was anything that you would take away from this presentation, I think it would be this. Second to that would be the next slide. But implications of research is one is that that there's a lot of empirical documents out there that we can use to educate our clients on the outcomes of CPT based on empirical studies. If someone is looking for better quality of life, then there are documents out there that can show that their quality of life can be improved through CPT. Younger clients have a huge success rate with individual treatment, and that's something that can be used for those who may be servicing the military population. The next thing is that intensive outpatient therapy is an option for those who want to go through cognitive processing therapy. And then let's see. So the last two here is like helping clients to feel comfortable about discussing some of the things that we may consider to be taboo, but it may be something that's really bothering them, which is hypersexual activity. Talking about that is not easy, and so being able to discuss that as a part of PTSD and also being able to say, hey, that CPT can help you with that as well, is something to take into consideration. And then one of the last things is kind of goes to the second point, which is being able to, we have found one of the implications from the research article is that that folks can benefit, especially at that late adolescent, early adulthood stage, can benefit from learning life skills that could help to increase quality of life. All right, so here's some social advocacy efforts that I looked at. One is that there are educational and voluntary opportunities right here in Columbus, Georgia. You just got to get with your military, local military to kind of find out what those are, whether it's, being a presenter to talk about CPT or being able to volunteer in some of the programs that they have available. That's something that could be assisted as well. So can be done as well. So the next thing is become a fully integrated CPT therapist. And I wrote down here assess, report, and revise because one of the things that we're charged to do, that we would be charged to do as a fully integrated CPT therapist is to assess how CPT is going, how's it working. And then the next thing is to be able to report, what we're hearing about, report those assessments as well as report what our clients are telling us about the CPT process. And then the next thing is revise, is being a part of the revision process to continue to evolve CPT so it continues to be impactful and helpful. There are, volunteers. There's volunteer opportunities to use CPT, therapeutic approach or CPT skills for local nonprofit organizations. I did pull a name up. I can't remember what it is, but I did pull a local organization up that does treatments to help families. That's nonprofit, and so that's something that is an option. Then last thing is to recommending CPT as a therapeutic approach to current efforts to increase mental health within Columbus, Georgia. There are current efforts to again touch the communities and help the communities with with mental health and ensuring good mental health. And so being one of those advocates to say, hey, CPT works, here's the reason why, here's empirical articles, things to that effect, I think is important. All right, here are my references. I have gone over quite a bit, but I am going to, at this point, turn this camera off and then we'll go to any questions that you may have.